So this is a bifunctional protein, which is a fusion protein where it binds by one hand to the PD-L1 ligand, and on the other hand is trapping TGF-beta.
And when it comes to employing this in clinical practice, what are we reporting at this year's conference?
So this clinical trial here is a randomized study of 2 doses, 500 versus 1200 milligrams of this very compound. And the main result is that the clinical efficacy is quite encouraging, particularly at a high dose, with response rate being in the range of 37% for patients which are PD-L1 positive, being particularly surprising for those patients with expression of PD-L1 in more than 80% of the cells, response rate being 81%. PFS data is also consistent, 9.5 for the PD-L1 positive population, being more than 15 months for those which are PD-L1 high. Safety data are pretty favorable, just some pruritus, skin rash, and some keratoacanthomas or skin neoplasms.
When it comes to expanding the platform to include possibly other disease types and disease areas?
So yes, I would say this trial is somehow done. Next step would be in stage 4 patients, those previously untreated, because this trial was in pre-treated patients, but we'll go to untreated patients with high PD-L1 expression and do a randomized study comparing this new agent, M7824, as compared to pembrolizumab. The other area of main interest in lung cancer would be stage 3, because of the TGF-beta inhibition factor, apart from the PD-L1 inhibition. It makes a lot of sense to do trials in conjunction with radiation. So a trial of chemoradiation plus this agent is being planned at the present time.
Okay. And in combination with any other targeted agents?
As far as I know, in lung cancer is not that being planned.